Hello everyone, welcome back to the channel. 5 common mistakes which patients do when they are on medications to control fits, or also called as anti-epileptic medications, and they end up having fits. Let's look at the 5 most common mistakes that they do. Mistake number 5. Stopping the medication on their own. Once anti-epileptic medications are started, it doesn't obviously mean that the patients have to take it lifelong, but let your doctor decide that. Depending on the condition, depending on the reason why they get fits, the anti-epileptic medications are given for certain duration of time. And in case if the patient is seizure free for certain duration of time, and also depending on the pathology, if the doctor feels that the tablets can be stopped, then only please go ahead and stop the tablet. Please do not stop on your own, because it is a very common thing to encounter patients who come to casualty with fits because they had stopped the anti-epileptic medication on their own. Mistake number 4. Sometimes the doctor prescribes you more than one anti-epileptic medication. For example, there are more than 20 different types of drugs which are used to control fits, and when your doctor thinks or finds out that your seizures are not getting controlled with one medication, he may add on another. Now what happens? Sometimes, maybe thanks to an over smart pharmacist, you may get the advice that look, both these are given for fits itself. Why are you taking 2? Just take 1. Trust me, these things are commonly seen, and patients end up taking only 1 medication instead of 2, or 2 medication instead of 3, and that can also result in patient having fits or seizures. Mistake number 3. Taking medications of inadequate dosage. What I mean to say is, for example, there is a drug called as levetiracetam. Now this is available in the dosage of 250 mg, 500 mg, 750 mg, 1 gram, etc. So if a doctor prescribes you a particular dosage, say 750 mg, please do not change it on your own, or maybe listening to some others' advice saying that look, I also had the similar problem, but I was taking 500 mg and things were working fine. Why are you taking 750 mg? So please don't fall to that. Take the dosage that your doctor has prescribed. If a particular dosage has been given, that's for a reason. So please do continue taking medication at the given dosage. So the mistake is taking an inadequate dosage of the anti-epileptic medications. Mistake number 2. Taking one medicine instead of the other. Well, you may be surprised, but yes, these things do happen. Because as I told previously, there are more than 20 different medications which are given for controlling fits. So for various reasons, it could be because of somebody else's advice, or it could be because of the cost factor. Sometimes patients, instead of taking one particular medication, they take another one because they have got the advice saying that both are given for fits itself. No, don't do that, because these medications are divided into different categories, and one particular group of medication works well for a particular type of seizure, and so on. So changing the medication on your own can result in fits. Mistake number 1. One is taking the tablet at a correct dosage but at inappropriate timings, which could be like, say for example, a medication is asked to be taken 3 times a day. Instead of taking 3 times a day, yaar, ye to bahut zyada ho jayega, I'll take just twice. That could be the one. Or even if a medication is asked to be taken, say for example, twice a day, please make sure that it is taken at a fixed time. What I mean to say is, in case if you fix as 8 AM and 8 PM, please stick to that, because there are incidences of patients having fits when they did not take the anti-epileptic medication at that particular time. Like the last medication was taken at 8 PM and the morning dosage was scheduled to be at 8 AM, but for some reason they couldn't take it. They thought they'd take maybe at around 9 or 10, but by then they ended up having fits. So please take your anti-epileptic medication at a particular fixed time every day. So these were the commonly encountered mistakes which patients do when they are on anti-epileptic medications. But let me tell you one thing honestly, that even if you are not doing any of these mistakes, even if you are taking the correct tablet, correct number of tablet, correct dosage at correct time, unfortunately sometimes it is still possible that you may still have fits, in which case you have to obviously consult your doctor again, and you may require some amount of drug modification or dosage modification. But that's a totally different thing which is beyond anybody's control. But what's in your control is to take the medications at appropriate dosage at the scheduled time. I hope this short video was informative. Thank you for watching.